Thanks so much, Minister, for those comments. We really appreciate you joining us here today at Can Forum. I'm going to very quickly introduce Senator Ruston, known to most of you. She is time poor today, so we're incredibly grateful that she has spent some time with us here this morning. Welcome, Senator.
Well, thank you very much, and I am horribly time poor, and I was just thinking the Minister, he's got lots of lovely tactics. I was thinking maybe he was filibustering so I'd have less time, but I wouldn't accuse him of doing that because, quite frankly, Mark and I do work incredibly well together because I think I've said on a million occasions there's lots of things for us to fight about politically, and the health of Australians should not be one of them. So can I just thank everybody in this room for the incredible work you do. Can I acknowledge Kate and Richard and the journey that you have taken over so many years. My first person I met when I came into this role was Richard Vines, and I'm sure you've been around, and most of the people in this room would know of Kate and Richard and their incredible work that they have done in this particular area. I really appreciate the opportunity to be here, and I will associate I'd like to associate myself with the remarks of the Minister and all of the good things that we can and should be doing as legislators and regulators. I will, of course, always support the government when they come up with good policy positions and when they do good things, and that is an absolutely categorical guarantee that I give everybody in this room. But equally, it is also my role as the alternative Minister for Health, the Shadow Minister for Health, and as part of the opposition, to call out the government when I think that perhaps they could be doing a little bit better. And I have to say that it's now 3.5 years on from when we first started talking about the implementation of the HTA review as an undertaking. I think it's almost 12 months to the day that the report was brought down for the HTA review, and I think we've probably done enough talking about it, and I'd really like to see that we actually start seeing some action, because it really does seem quite incredible that in Australia today we aren't world's best practice when we're getting Australians timely and affordable access to the medicines and treatments that they need. And none could be more obvious than in the area of rare cancers, where those treatments are fewer and further between than they are in some of the more common cancers. So I'd say to the government, you've got a perfect opportunity this week on the first anniversary of the HTA review being brought down to actually announce what you're now intending to do. Can I also say in relation to that, in terms of Pharmaceutical Benefits Advisory Committee, we need to make sure that this is operating in the way that is actually delivering the best interests of Australians. And we didn't need a review to understand that we could actually do things better. We were extremely disappointed to find out that some applications were actually were being capped in terms of how many applications were being assessed by PBAC, and we're also starting to hear that the requirements post-PBAC approval are starting to become more onerous. So I'd say to the government, really we're a first world country. These shouldn't be the things that we're talking about at a forum like today. And just finally, the last thing, there was a very big commitment, a commitment that was absolutely bipartisan, to stop genetic discrimination in life insurance. That was a promise at the last election. It was a promise in the last term of government. We haven't seen the legislation yet, and I'd be saying to you, you should be beating the drum on this. It is a broken promise, and I will stand by you if you want to continue to fight this, because I think it is absolutely a travesty that we haven't seen that progressed. So let's start the fight on that. But just finally, my absolutely committed to making sure that we have got access to the kinds of medicines, treatments and a healthcare system that I think Australians deserve. But one thing I would like to say is we need all to work together to make sure that we're starting to focus on prevention and early intervention as our number one place that we start in our health system. And I'll probably get yelled at by some of my friends in the room for plagiarism, but what do you say? You prevent what you can and you treat what you can't. We must start preventing what we can. So thank you.